everyone. I'm Dr. Karim with the Healing Wellness Show, and we're going to be talking about IV vitamin therapy. So, we're going to be talking about what is IV vitamin therapy, what does it do, who needs it, why I recommend it, and why I believe this is better than your regular vitamins that you take over the counter. Okay, so let's talk about understanding vitamin IV. So, one of the questions that came in is, what exactly is vitamin IV therapy? Well, vitamin IV is a treatment where it's really essential for vitamins, minerals, and it's the fluid that gets delivered directly into the bloodstream. So most people will say, hey, doc, I take vitamins. Well, how do you take them? Well, it's usually pills and they drink them down. The absorption rate on that isn't great because you've got the digestive system that kind of breaks it down. Okay. When we do IV, guess what? It gets 100% absorbed through the bloodstream, and that's what makes it really effective. And that's why a lot of times when we're doing the hydration or replenishing nutrients or supporting overall health, that patient, while they're getting that IV, perks up and they feel it. And sometimes they taste it as well. So that's the beauty of IV is it's 100% absorption compared to when you take it orally. It kind of breaks down a lot of it, so you're not absorbing as much. Or if you're taking a lot of it, your body's going to excrete that extra that didn't get absorbed. So another question that we've got here is, what are the most common reasons people seek IV therapy at the wellness center? Well, we see patients for many different reasons, but some of the most common is immune support. And that's during a lot of times during the wintertime, the flu season, COVID, just any congestion, anything like that. Vitamin IV for immune boost wise will help with that. Hydration and recovery. We have a lot of athletes that's, after exercising, or someone's going to travel and they're going to be sitting a lot, or long nights, or people that work a lot. Hydration and recovery, immune vitamin IV is really awesome. Energy boost, whether you're feeling sluggish, tired, fatigued, burnt out, chronic stress, that's really great with our energy boost IV. We use it a lot with migraine relief. We use it with skin and beauty. We put biotin in the bag, and that helps with anti-aging. Or detox. We have a lot of detox. A lot of people that like to drink alcohol, they drink a lot. Well, guess what? They come the next day and get a little bit of IV and they feel a lot better. Or just detox of metals, or just detox in general. So another question we've got here, can IV therapy help with chronic conditions like fatigue and fibromyalgia? Just like I mentioned, yes, absolutely. Many chronic conditions, including fatigue, fibromyalgia, even some autoimmune diseases, are all linked to nutrition deficiencies. So we're basically just putting the right amount of nutrients in there for that body to start healing itself. IV also helps with providing high doses of vitamins like the B12 that we put in there, or magnesium, or vitamin C, which is really popular with a lot of patients. Glutathione is also another one that we love doing. Glutathione is for inflammation, decreases inflammation quite a bit, but also supporting energy production, reduces inflammation. Many patients really, like I said, they notice that difference from whether one or two treatments. And usually they like to continue doing that, whether it's once a week or once a month or once every 2 weeks.
How long does IV therapy or vitamin therapy, how long does it last in your system? And will I notice that it will be working right away? Will I feel the difference?
With IV therapy, some people will notice it right away. Some people, they need multiple. And that really all depends on your hydration level. If you're known to drink lots of water throughout the day, then you won't need as much. And you can see it. When we do the IV therapy, if someone's taking that vitamin down, that bag down real quick, they're really dehydrated. So the body is like, hey, you're giving me water, I'm going to absorb it. But if they're really hydrated, it takes a lot longer for that drip to go through them. So, and also it depends on the vitamins that we put in there. And that's why we tailor it to the person. That's why we'll have a discussion first, be like, hey, what is it that interests you in vitamin IV? Is it because you're an athlete for sports performance? Or is it because you get sick all the time? Or, hey, I just want to try it, or, hey, I'm hungover. So it really all depends on the person and what they need it for.
So if I am taking IV therapy, would you recommend an average? An average, would it be once a week, once a month?
That again depends on the person. Typically, when you first start, if you haven't done IV therapy, I would say once a week just to get the hydration levels up, get you feeling good. Because, like I said, it could take one, could take three before you start feeling better. Once we've established that, then we could push it out once every 2 weeks. Well, okay, I'm still feeling great. Okay, let's, if you want to keep pushing it out, we can push it out. But a lot of times you'll see that difference because you might have a surge of energy and it lasts you for a week, but then it depletes. Well, that means, okay, let's continue then doing that on a weekly basis. But say it lasts you 2 weeks, well, we'll start doing it for 2 weeks or once a month or, so it depends on the person. Depends on what they're doing it for. Like for athletes, we have athletes come in once a week because they know the benefits of it. Where we have people that just for wellness, they don't have any issues going on. So they do it once a month. Or say someone that has chronic inflammation, we need to do it on a regular basis. So again, that all depends on you.
So if I'm doing IV therapy, my question to you is, do I need to take my vitamins during the week?
That really is going to be up to you. Like I said, absorption rate with vitamins, it depends on what vitamins you're taking. And we can discuss that in the appointment. But if, say, you're coming in for a high dose of vitamin C and you're taking vitamin C, I say, you taking your vitamins isn't going to hurt, but you're probably not using that. It's probably getting excreted. So you're kind of wasting it. So I would say hold off on it. But at the end of the day, it's going to be up to you if you want to continue doing it because it's just part of you, your habit. But a lot of times if your body doesn't need it, it's just going to excrete it out. So you're not hurting your body.
So in a way, vitamin therapy is a lot better, what I hear you saying, because it's absorbing throughout your entire body. But when I'm utilizing vitamins, let's say I take vitamins right now and I go pee, do I pee that all out normally?
Yep. So remember, it goes through your digestive system. Your digestive system is going to break a lot of it down. Your digestive system is also used because it's going to absorb the nutrients, right? Once it absorbs the nutrients, it puts it in the bloodstream. So if, say, you took, let's go with 100 grams of vitamin C, okay? Or let's say 1,000 because it's usually a lot more. 1,000 grams of vitamin C or milligrams of vitamin C. You're probably going to maybe absorb half of it, maybe 40% of it, but then the rest gets excreted. Where with vitamin IV, you're absorbing 100% of what we're putting in there because it's directly into the blood. So there isn't that middleman that's trying to clean what's going in the digestion system, and then the digestive system is breaking things down, and then you're absorbing some of it. With the IV, you're getting 100%. That's why it will last you longer.
So it makes more sense to the consumer I think vitamins are fine, but it makes more sense to do the IV therapy because it goes into the bloodstream and it stays in there a lot longer.
Yes. And again, that depends on, if you're a first timer, it might, your body might absorb it within a few days instead of lasting you for a week. That's why in the beginning, we need to see how long that lasts and kind of put you on a regimen. And then after that, you can go on the maintenance wellness IV drip.
So maintenance wellness IV drip, would that normally be maybe like 3 times a month? An average, just say an average. Everyone's different.
I would say everyone's different. On average, it's like once every 2 weeks or once a month for a lot of people. The elite, the ones that really want to do things with their health and wellness, those are the ones that are, going to be doing once a week. We have like people that start with inflammation. We might be doing that twice or 3 times a week, depending on how they're absorbing that and how long it's lasting in their system. So a question that we got here is, what sets the Wellness Center IV therapy apart from other providers? Well, like I said, we take an approach where we're actually customizing that to the person. So we sit with you, we do a consult, we see what your needs are, what your wellness goals are, and that's where we can customize the infusion for you. The infusion that we have, it's not a bag that we buy that's already pre-mixed. Some clinics do that. We don't. We actually get the actual vials from the pharmacy and we add it to the bag. A lot of times we do it in front of the patient so they can see what we're adding in there. And it changes color, which is pretty cool to see. And that depends on whether it's vitamins that you need, whether it's minerals. Biotin is another infamous one that a lot of people are coming in for, anti-aging. So it really all depends on what you want. Question that came here is, what are some of the most popular IVs that we offer? Well, like I said, we offer lots of them, but I would say the biggest ones will be the Immune Boost package, because that's packed with vitamin C, zinc, magnesium, B vitamins, and it helps fight the cold, flu, when you're feeling sluggish, nose is dripping. That's a really popular one, and especially in the wintertime. A hydration drip is another one. We use that with athletes, where we call it either hydration drip or IV performance, because you could do it whether before a workout or after a workout for recovery, and also avoids dehydration. Another popular one is the beauty drip, and that's the one where we're putting glutathione, the biotin. That's for a glowy skin, strong hair. We have a lot of females that will come and say, hey, my hair's thinning, and that will be a perfect one for them. Plus, they get that glow from it as well. And I would say another one would be just like an energy booster. Some people will want that because we've got that amino acid blend in there. I actually do that quite a bit because I like to go work out. I've got a regimen. I do that at least once a week with the B complex vitamins and the amino acids. And that fights the fatigue or that muscle tightness, and it helps with strengthening the muscle.
Very good.
So another question that came here is vitamin IV safe for everyone? And for the most part, yes. For most people, I would say yes. But there are certain conditions and that's why we have that consult beforehand to make sure that you are fit. And some of these conditions could be kidney disease or heart problems, or, some of these things we just need to know a little bit more, because we might need to change the fluid that we're putting in. So we do use saline or lactated ringers. So one could make you swell. So if you've got heart condition, then we wouldn't use the saline because that will make you swell. We would use the other one if you're a candidate. So it really all depends. And that's where we kind of undergo that medical review before starting an IV to ensure it's safe for you. So I've got a question here. Can you share a success story from a patient who benefited from IV therapy? Yes, we have many stories, but I'll give you one that's most recent. So an athlete, he's a marathon runner, came in after a run. He was exhausted, sluggish, because it was in the summertime. So obviously hydration there was a big concern. He was starting to have some muscle crampiness and just needed a recovery. So we did the recovery drip on him. We did 1,000 milliliter instead of 500 milliliter just to get him more fluids there. Added some vitamin C as well. And really, during it, you could see he was kind of like sluggish, kind of like down. And I would say about 60% through the bag, he started to like talk and perk up, and that's where you could see the difference. And he definitely saw that. He got up, he's like, oh, I could run another marathon. I was like, no, we don't want to do that. But yeah, he felt great. I could give you another example. This one will be a patient that came in with chronic migraine. And I love migraine patients or headache patients because IV just helps tremendously with that. We started doing IV therapy, and really within a few months, that one does take a little bit of time, but really within a few months, the frequency of the headaches went down. And I mean, he still gets it once in a while, but it's not as bad when he gets it now. So those are some of the stories that I love sharing. If someone doesn't want to do IV therapy, the other popular one is ozone IV therapy. And that will be something that we're going to be discussing on our next podcast. So that's why you want to stay tuned, and follow us on the Healing Wellness Show, also on our Facebook, Instagram pages, so you can follow us on the next episode, which is going to be all about ozone IV and the benefits of it. So I've got another question here. What should someone expect during their first IV therapy? Well, again, like I said, you come in, we'll do a consult, we figure out what IV therapy is going to be best for you. Put you in a relaxing setting, start the IV, and the IV usually lasts anywhere from 30 to 45 minutes. That, again, depends on your hydration level. Most people will sit there. We tell them you can bring a book if you want to read that. We usually have a TV that we have shows on that you can watch, or you can listen to your own music or podcast. Maybe the Healing Wellness Show podcast while you're getting your infusion. But most people will see the benefits immediately or during the infusion and that energy level within the next few days.
Okay, I'm going to ask a question, okay? In IV therapy, what is in it?
So IV therapy, again, that is customized to every person. So it could be like the immune boost bag that has vitamin C, magnesium, zinc, B vitamins like the B complex. We do B12. We do glutathione. So it depends. There's the athlete recovery, which has amino blends, has minerals, has vitamins. So it really all depends on the person. But we do have lots of different vitamins and minerals and amino acids that we can put in a bag.
So what I hear you saying is everyone's different. So when you take certain tests on me, you're going to see what my body needs.
Yes. Yes. A lot of times we can either, just by you talking with us, we can figure out what will be best. It wouldn't hurt if we put, say minerals in there and you didn't really need minerals. It doesn't hurt your body. Again, if there's a lot, your body's going to excrete it, whether you go to the bathroom and excrete it out, or it will sit in your body. So there isn't really harm on getting a lot. The only thing is, again, certain conditions. That's why we have this consult. But we do also do blood testing, and we use the blood test to really hone down on your wellness journey. And that's for someone that comes in like, hey, doc, I want to do a wellness journey, or they have a lot of health conditions and want to feel better. Then yes, we do a customized blood panel where we're checking the vitamins, the minerals. We're also checking your hormones because you might be a candidate for hormone therapy, which is another podcast that we'll be talking about here in the future with nurse practitioner Amanda, who is an expert at that and has done many, many consultations and procedures on hormone therapy.
So another question I would be asking would be, is this affordable or is this just out of reach?
Yeah, this is very affordable. This is, if you're coming in once a month or, multiple times, usually we do have a package for you, but just coming in once, the IV therapy, depends on which one you do, is anywhere from $100 all the way up to $250. So it's pretty affordable.
And do insurances cover this, or is this way off?
No, this is wellness. Insurance does not cover wellness. So this is going to be, hey, I want to feel good because I'm sluggish. If you want insurance to cover anything, then you can go to the ER or urgent care. And a lot of times they'll, give you some pills or, tell you, hey, go get some over-the-counter meds. This is just, like I said, it gets quick into the bloodstream, and that's why you start to feel better a lot quicker.
What's the main difference between wellness and insurance?
Wellness. So insurance doesn't cover wellness. Wellness just means that it's your choice that you want to do this treatment or whatever other treatments that we offer for wellness. Usually insurance, it's a set thing that is on paper that says insurance covers X, Y, and Z. So for example, insurance will cover like you going to the ER or urgent care, or you getting that medication. Sometimes it doesn't cover some medications. So like I said, certain medications will be covered, or certain things that you do at a clinic might be covered or not. When it comes to wellness, that's usually like maintenance care. Another way to explain it or analogy is like a car, right? You have car insurance and there's car maintenance that you have to do that insurance isn't going to cover. So some things that car insurance won't cover is like new tires or oil changes. Those are maintenance, or call it wellness of the car. If you don't do them, then that will get worse. And then yes, insurance might cover that, but it might be a lot, or it might be a total, right? You have one body. So if you want to keep that body going, then there are things that you're going to have to do outside of insurance. So I always say, don't have insurance dictate your health. You dictate your own health.
Why do most places that offer insurance do not offer IV solutions, or IV therapy?
Because it's not covered by insurance. A lot of places, if it's not covered by insurance, then they won't do it. In our clinic, I don't have insurance dictating our patient's health. We want the patient to come in, tell us what's going on, and then we'll give them what treatment plans or what best therapies for them. And again, at the end of the day, do you want to feel better a lot quicker, or you want to continue doing what you're doing because insurance is dictating your health?
Why do most hospitals not promote IV therapy and they know that it works?
Because insurance doesn't cover it. Hospitals will do what insurance covers it. And that's why a lot of what we do at the wellness clinic isn't covered by insurance, because we don't do medications or surgeries. That's typically what insurance will cover. Insurance will cover like acute care. I say anything that's chronic care, it doesn't cover. Acute care is like, hey, I broke my arm and I need that fixed. Or, hey, I cut my hand and I need stitches. Or, hey, I got in a really bad car accident and, we need to do surgery. But when it comes to long-term longevity health, it doesn't cover that.
What I hear
Future, not right now.
So what I hear you saying is when you're like a car accident, or if you're or something's, heart attack, that's where the hospital is really great for what they take care of. But for you, your focus is on the whole body, meaning if you're not feeling well, meaning you're feeling sluggish, you're in pain, neuropathy, whatever it may be, that's where we go to you.
Yes, exactly.
Okay. The next question would be, how do I know that my infusion won't cause a bad reaction?
With vitamins, usually if you're allergic to a vitamin, you would know it by now. And if there is a reaction, then we can always customize that for your next IV. I would say in my years of experience, we really haven't had anyone have a reaction to the vitamins.
Okay.
Okay. Last question I've got here is, how can I book a session to get IV therapy? Best way to do is get on our website. You can call us directly. You can stop in for a consult. But if you do mention that you heard us on the podcast, you will get a $25 discount. So do mention, hey, I heard you on the Healing Wellness Show. Anyone that mentions that usually will get a $25 discount on their first IV therapy. So it'd be a good way to see how it works and test it out yourself.
What if we have a group of people that want to do this? Can I get a group discount?
Absolutely. The bigger the group, the better. Also, if there is, like we've done it for bachelor parties, bachelorette parties, just parties in general, where if it's big enough, we actually will come to you. But yeah, there is a discount for that as well. Referral discounts as well. If you refer a friend, even if it's not a big group, just referring, you coming in, doing an IV and referring a friend, we will give you a discount as well on your next IV or treatments in the clinic.
Awesome. One more question. What other shots do you offer besides IV therapy? Can you go into that just a little bit?
So we do lots of different, like a B12 is usually a shot that we do. Glutathione is a push that we do. We can do NAD, which is something a lot of people are starting to seek, which is for energy. We do have a lot of peptides as well that we do. So there's lots of things. Again, that will be depending on your consult when you come in. You tell us what your wellness goals or health goals are, and we'll start recommending what's best for you.
Awesome. So before somebody goes in to get IV therapy, are there a few things they need to do? Do they need to eat a granola bar or be fully hydrated? What are some of the things that they need to do before they come in?
Yeah, that's a great question. And typically when someone books an appointment, we actually go over that with them over the phone. But we usually say, if you can start to hydrate a day or two before, if you're not used to like drinking a lot of water, I'd say that will benefit you for when you getting stuck with the needle. If the more hydrated you are, the better it is, so that the veins are kind of hydrated basically for us. Eating is great to do so you're not sluggish, or, we once in a while might have someone that passes out because they don't like to say blood or something like that, or get queasy. That could help with that as well. But yeah, that's a great question. But thank you again, and our listeners. And don't forget to subscribe to the Healing Wellness Show and follow us on those social media platforms for more tips on holistic health and wellness. If you're feeling that, drained, sluggish, or you want that extra wellness boost, that IV therapy that we've been talking about is going to be a game changer for you. And come and see us at the Wellness Clinic. Like I mentioned, the Healing Wellness Show, if you mention that, you'll receive that $25 coupon that will take off of your IV. We'd love to help you feel better. And until next time, you guys stay healthy and stay well.